Hi, my name is Adrienne Green. I've been a registered nurse for 25 years. I've worked here at UCSF for the last 12 of those. We're here because we're extremely concerned about the announcement that was made last Friday. The nurses who work in the front line here, we heard at the same time that the media heard it, that we're now a designated Ebola center. We are frightened. We're outraged. We are not ready, as you've heard from all the nurses here. So let me tell you a couple of examples of why we're not ready. I went to a meeting last week. There's been 2 town halls that I know of. There were very few bedside nurses at these events, but I went to one on my off day to hear about the equipment that is going to be, supposedly will be provided to us at some point. It was substandard, piecemeal together equipment. I watched a demo nurse dressed up in this equipment, and as she moved around, I noticed that her neck was exposed. We asked her to look at the ceiling, and sure enough, there was a gaping hole in the equipment there. We asked, what of the equipment is viral rated not to let a virus through, and only one piece of the equipment was? And one of our surgeons spoke up at the meeting and said, I know that piece of equipment, that gown, I've used it, and it leaks. You will get bodily fluids on your skin if you use that gown. Administration took the comments and said, this is what we have right now, and we're working on it. The only training I've received as a UCSF RN is I got an email last week that said I had a mandatory online module to do. So I opened it up and found 8 slides with nothing but bullet points. One was a title slide and one was references. 6 slides of content that said essentially nothing useful in telling me what I am expected to do when an Ebola patient presents in front of me. My department is a recovery room and the preoperative area here. We bring patients in from outside daily, up to 75 people. We don't ask them screening questions. We don't even ask them, have they traveled? Do they have any symptoms? We have not been instructed what to do when and if that occurs. When I have that Ebola patient in front of me, what do? We don't even have a private room to put that patient in. We haven't been given any answers. We have no equipment and no training. I'm scared. The chatter here at the hospital, the nurses are scared. We're all scared. And we're here because we care about each other and we care about the community. And we're not going to let this happen. That's why we're here to insist on what ought to be a no-brainer, right? We want the absolute highest quality standard protective equipment. We want the best stuff. And if they don't want to provide it to us, then they should don the substandard stuff and walk in here and take care of these patients, right? When it happens. They should not be putting us on the front line without giving us the best. We should have the best equipment, right? We're the ones that are going to put ourselves on the line for this. And we need training. We don't need any more emails or online modules. We need human-to-human interactive training and repeated training. And another thing we need is staff. If we've designated ourselves an Ebola center, how are we going to staff for that when we're fighting constant staffing shortages as it is? Who are these magic nurses that are going to come and save us? We're not sure. So we're on the front line, and we're here to tell you we're not ready. And it's hard to say that, but that's the truth. We're not ready here. They say they're doing their best, but we're here to tell you it's not true. It's not enough. I'm going to pass it on to one of our labor and delivery nurses, okay? Kirsten Klickner.
I'm Kirsten. I'm a nurse on labor and delivery. I've been a nurse for 9 years, and I'm also a mom. And I'm here to tell you that we have not had any hands-on training in our department. We function as an emergency room. We've had a lot of theory, but have had no hands-on training, and we're scared and we're angry. And all we're asking for is, it's very simple. We just want to be prepared to be able to take care of ourselves and our patients, and we haven't had that. So that's all we're asking for. Very simple. We want good training. We want to be prepared, and we're not. I'm going to pass the mic on to Charles Witherall, who works in our outpatient setting.
Hi everybody, I work in the outpatient department. My name's Chuck Witherell. I'm a clinical nurse specialist. I've been a nurse for 40 years. We are not getting any training around here, and we absolutely need to have the training. We can't do our work without it. We need training that evolves with the changing knowledge of what this disease entity is and how it works. We need equipment of the very highest standard, and we need a plan. We need a plan that has actual components which are communicated to us and communicated well. If we don't have these things, how can we possibly do what, as nurses, we need to do for people? We just can't do it. We are not ready at UCSF to do this.
I'm Maureen Dugan. I'm a registered nurse here. I've worked at UCSF for 25 years. Ebola is the focus today, but as past inadequate responses to H1N1 have shown, we need to be prepared for all pandemics. It is irresponsible that UC does not have the optimal standards and protocols already in place. You do not educate your frontline staff with an email. We nurses have met with Governor Brown and testified before Congress. We have reached out to President Obama. We will continue to advocate for optimal personal protective equipment, ongoing interactive training, and sufficient staffing levels. We want UC to work with us nurses so we can all deliver top 10 care. Thank you.
All right, thank you all. If anybody has any questions, we have some nurses who are able to answer any specific questions.
Yes. Why? I mean, there are people here who are being paid hundreds of thousands of dollars to be management, to put in these procedures. Why haven't the management here implemented proper mandatory procedures?
We've been sounding the alarm for 2 months. We did a survey, and overwhelmingly across the country, nurses have not heard any protocols, no training. We have been continuing to sound the alarm, and now UC is scrambling. We are outraged that UC says they're ready. They are not ready. I went to the town hall last Friday. There were 2 direct care nurses there, plus myself, asking questions, and they had not received any information, and yet UC is saying we're ready. We're not ready.
Now, the union has called for Governor Brown and President Obama to institute mandatory procedures. Why are they refusing to institute mandatory procedures nationally?
We are calling for state mandates. We're calling for national mandates. We're going to continue to fight for safe patient care so that we can deliver safe patient care. We're here for patient care. We're not here for profit care. So whatever the force may be, we're going to be out here until we get safe mandates so that we can continue to come to work as we've all done for years and take safe care of our patients.
I'm Bridget Parr. I work on 12 Long, which is the musculoskeletal unit. And we get post-op patients is the majority of our, we get some direct admits, but we get post-op patients. Patients that had surgery already. So they come through the pre-op, have their surgery, go to the post-operative area, and then come to us. But they are not screened in pre-op as far as any contact with anybody from Africa, South Africa, or West Africa rather.
So you don't ask those questions?
No, we have not been instructed to ask those questions. The only place that I am aware of that has been asked has added a workflow to reflect any admission is the emergency room. That's it. So
why is it? It seems like a simple thing to direct everyone to ask those questions. I don't understand. What is the problem?
Management has not added that in there yet, and that's one of the things that we're talking about, that we don't have the education, we don't have the equipment, we don't have any training on it at all. And even when I asked my manager about it, she said the only thing that she's gotten is emails, and it's not sufficient.
So there's no real emergency here as far as making sure you're prepared for possible Ebola patients?
Not here. So.
Have there been any trainings here at this hospital on Ebola, on how to handle it?
Not for the general staff. The only trainings that I'm aware of are those that have been held for this special volunteers that are volunteering to take care of the patients. And even that, they just started. They just started last week.
Are there any volunteers here?
Hi, my name is Adrienne Green. I'm a registered nurse here at UCSF Medical Center for the last 12 years. And we're here today in response to UC's announcement that we are ready for Ebola. We are not. We have, as frontline workers, as all the nurses standing here have just recently said, in none of our departments do we have any personal protective equipment or any training on how to use personal protective equipment, or the staff to manage that. We've received a couple of emails. That does not constitute training. The only training that I've received came by email. It was 8 slides that I was required to log into and view, and the only information in there was that we would be following CDC protocol. There was nothing to guide me in what to do when an Ebola patient is in front of me. I work in the perioperative department. When patients come to our department, which we admit directly there, nobody is screening or asking them any questions to see if they've had Ebola or been in contact with anybody, or if they've traveled. We're not doing any of that, nor have we received instruction on what to do if we identify somebody as at risk of having Ebola. We don't have a private room where we can put them. We've seen the personal protective equipment that was presented last week as what will be used, but that equipment, as of last week when I was in the emergency room, was not available in the emergency room. It's not available in any department that we have come in contact with, and again, apparently there's some new trainings for a small group of nurses. That's not enough. It's not enough.
Did you say it's spell your name?
What we're looking for is a highest standard of personal protective equipment for the nurses, for all the frontline healthcare workers, and training to go with it. My name is Adrienne Carrera, E-R-I-N-C-A-R-R-E-R-A. I'm going to pass it on to Bob Burns, who's one of another nurse here at the university.
What's the speaker?
I'm sorry?
Speaker.
Oh, sure. Do you need it down low? So I'm not in your shot. Does that work?
Okay, so I was at the training this morning. I was the representative for CNA, NNU. At the training, there was 130 people involved from the UCSF Medical Center. I was the only union rep. There was very few clinicians there. I will say it's a step in the right direction, but it's long overdue. I think our CNA stance is that we put them on notice. Our national organization put everyone on notice long before the first patient hit the United States shores and ultimately died. Last week we had meetings in Oakland and Jerry Brown's office. 350 nurses, maybe 400 nurses showed up from all different area hospitals in California. All of them said the same thing. The administration saying we're ready to go, we're fully prepared for Ebola, and every nurse there told the OSHA representatives, Occupational Health and Safety, that is indeed not the case. There are, similar to what we're seeing here, no protective gear that meets the standards, the most stringent standards, and we aren't asking for much. You know, we're happy to take care of anybody. We don't care if you have insurance, we don't care anything about the demographics. We're ready to go, but we need to be protected too. And it's not just us and our families, but it's the patients that inhabit this facility and every other facility in California and the United States. So we don't think that's much to ask, too much to ask, and we're wondering why it's taken this long. Today was a step in the right direction. We're starting to get the workflows organized today. We're starting to order supplies, but this is long, long overdue. And if the patient shows up today, we're not ready. Neither are any of the other hospitals in California, regardless of what you hear from administration.
My name's Maureen Dugan. I've been a registered nurse at UCSF for 25 years. So Ebola is the focus today, but as past inadequate responses to H1N1 have shown, we need to be prepared for all pandemics. It is irresponsible that UC does not have optimal standards and protocols already in place. You do not educate your staff with an email. Nurses have met with Governor Brown and testified before Congress. We have reached out to President Obama. We will continue to advocate for the optimal personal protective equipment, ongoing interactive training, and optimal staffing levels. We want UC to work with us nurses so we can all deliver top 10 care. That's all we're asking.
So last week, UCSF said that 70 people had volunteered for the Ebola unit. Who here is among those 70?
No, I can speak to that. I think they're really, if there are 70, they aren't trained.
Can I put you on the mic?
Oh, do you want that? Yes. Sorry. Do you want that mic or you want?
No, you're fine on the speaker, so everybody can hear.
Okay, you need to put it like close to your mouth.
Yeah, that's fine.
Okay, nobody's trained fully. I don't know how many volunteers there are. I didn't see 70 clinicians in there. I was in the training this morning.
I asked who of this group is of the 70 who volunteered. Anybody?
He did. Bob did.
Well, I'm in the group, but there's another nurse that's a clinician. I'm an observer today, so there's one of our group that's not here at the moment. But
so why hasn't the hospital done the training and gotten the proper
well, they're
equipment?
saying that they're fully ready to you, but I'm telling you they haven't done the training. I was at the meeting. I've been at many meetings. I'd say that there's a mismatch across the state, across the country. Everybody's saying Texas said they were fully ready, and they aren't. And they aren't ready, and we aren't ready. Why? That's a question for them. We're not fully trained. We're not even beginning training. We're just working out. We're asking for the training.
But they don't even have the equipment, you're saying?
Okay.
We're saying that the equipment they have is inadequate. And we don't know how much equipment they have. One of the problems that's going on here is there's a major lack of transparency. If there's 70 nurses who volunteered, we don't know who they are, and we don't know of any training sessions that have been offered to them short of what's going on today. The lack of transparency here is one of the problems, right? We need to all be trained. It's not just the 70 people who have volunteered to do direct contact with the Ebola patients. There's a couple of things here, right? We don't all get to volunteer. Sometimes people present in front of us ill, and as nurses, we are required to treat them, and we are responsible, and that's what we do. We're nurses. We take care of people. So when the Ebola patient shows up in any of our departments, we're going to take care of that person. So we deserve to all have the training and the equipment. So what I'm saying is any trainings that have occurred have been recent. We are behind the ball here. To go and announce that we're ready on a state level it's arrogant and it's irresponsible. And if you're 99% of your frontline nurses haven't received any training and aren't even aware of where to get one and don't have personal protective equipment in their department, then let me tell you, we're not ready.
What equipment do you not have to take care of them today? We don't know.
Great question. We really don't have anything. In my department, I would have a paper gown. I might be able to dig up a plastic apron. I have a mask and a pair of goggles that will inevitably fog up when I put them both on together.
And the physicians have been trained for that.
The nurses are calling for mandatory protocols. They're calling Governor Brown to institute them and President Obama. What's the position of yourself in the hospital concerning mandatory protocols for treatment of Ebola?
We are developing protocols for every aspect of the care of the patient with Ebola. We've started those protocols, and we're actually doing a full-day working retreat today in order to complete those protocols.
So you're not, what's your position on so you're against the mandatory protocols?
I believe that we need protocols for all of the aspects of care of the patient with Ebola.
So you support the call of the nurses for mandatory protocols, or against that?
I think that every hospital needs to develop their own protocols.
So every hospital should develop its own protocols, that's what you're saying.
Why wouldn't you train all of the nurses?
The training is incredibly intensive. We want a very highly trained, dedicated group of staff, whether they're physicians or nurses or respiratory therapists, who are able to go through the training several times, practice in their PPE so that they can be the most expert group at caring for these patients, and are having the training such that they are the most experienced and can provide the safest care for that patient and for everybody else in their environment. Training everyone would not help us to achieve that.
So what you're describing, that kind of training, it sounds like that's what they believe, the nurses believe, all of the nurses should have, because as they point out, you don't know who's going to be the first point of contact. Might not be somebody who's highly trained. How realistic is it to train all of your nurses to that level?
It would not be realistic to train all of our nurses to that level.
Because of the sheer number, or what?
The sheer number and the intensity of the training.
And again, to their claim that everybody should have this top line personal protective gear, you have 2 tiers of gear. How do you respond to them saying that there should not be a second tier, they should all have the top line?
The tiers are actually defined by the CDC, and so the way we've tiered this is exactly as it's recommended by the CDC.
Any direct care nurses should have access to and training for the highest standard of equipment needed to take care of an Ebola patient. Absolutely. I'm talking about direct care nurses here at the University of California, San Francisco. I'm talking about the nurses who receive patients in clinics, in the ambulatory surgery centers. Yeah, every nurse who has direct patient contact, we need to have access to proper equipment and training to use that equipment. Absolutely. That seems like it should be a no-brainer. We asked Governor Brown to implement the same standards on a state level that we asked President Obama to issue at a federal level, because we don't believe that various hospitals in a fragmented healthcare system could come up with proper standards, each on their own, kind of piecemealing together which protocols they'd like to follow. We believe there should be one standard for the entire nation, and that it should be the top-notch standard. So we asked Governor Brown, the same thing that we asked President Obama, the same thing that we asked OSHA to implement in California, and the same thing that we have insisted that UC implement across all of our medical centers, and that is highest level of personal protective equipment. That is hazmat suit, right? Hazmat suit and full viral protection. That is hands-on training for all direct care nurses, end of story. That is adequate staffing to pull this off, and it is protections and care for the healthcare workers that are going to put themselves on the front line. Many of us are going to be working tonight. Many of us will be going back to work this afternoon. We'll be here all night tonight. We expect to be fully prepared and trained by then. Yesterday.
Yes. We have clearly made demands to UC. They're fully aware of what we, the nurses, want. What I will tell you is they were very proud of their 2 months of work, and yet no direct care RNs have been involved in that. 2 pediatric nurses stood up and asked questions. One works in ambulatory care, one's part of the transport team, and they both said, what do we do? They have received no information, and UC's answer was, we'll get back to you Monday or Tuesday. And we feel like that's why they're finally moving, but they're scrambling. They're just starting stuff, and again, it's a very few amount of nurses. One of the nurses asked, what do you consider a portal of entry? We have clinics, we have offices, we have all these different areas. She said, what do you consider a portal of entry? And Dr. Adrienne Green said, everywhere. Well, we're not ready everywhere.
So Adrienne Green. So UCSF Medical Center has been preparing to care for a patient with suspected or confirmed Ebola since August. In the last several weeks, with what has happened in Texas and across the United States, we have increased our planning efforts. We have a dedicated unit that we have prepared over at Mount Zion for isolation of a patient with suspected or confirmed Ebola. And we have many plans in place and have acquired all of the necessary personal protective equipment to care for a patient with Ebola. We either meet or exceed all of the CDC recommendations for PPE requirements. And we have a very robust plan for screening and triage of all patients who come into the institution from whatever portal of entry in order to screen and assure that if a patient is at risk for Ebola, they will be isolated and managed appropriately. So it requires a lot of planning and protocols and procedures. Right now, with the prevalence or lack of prevalence of Ebola in California, we're not feeling as if we need to hire new personnel. The nurses, there are enough nurses trained to staff the isolation unit were we to have a patient who screens as at risk for Ebola.
But what about, again, as was pointed out, that any nurse could be the first point of contact? What percentage of all of your nurses?
All of the nurses in the ED who would have contact have been trained.
Okay. That's still not telling us a percentage, though, of your total nurses.
But right now, we're training the nurses who would be at risk for coming into contact with a patient with Ebola. So a nurse on our medical unit at this point would not need training, but someone who would be staffing our isolation unit needs to be trained, and the nurses in the ED need to be trained, and then in these other portals of entry, the staff there need to be trained, and they will be trained this week.
I'm here today to ask my university to give us adequate training and protection to treat Ebola patients if Ebola patients come here.
Are you shocked that you haven't been trained yet with what's been happening all over the country? I mean, it seems there's a panic. Dallas happened some time ago and no training. I mean, this is one of the top facilities in the world.
I am shocked, but at the same time, our hospital has been no different than any other hospital. It's kind of been, there's no enforcement standard. Even if the CDC has recommendations, there's no enforcement, which is why we asked Governor Brown to implement state standards.
And what is the problem of mandatory enforcement in California hospitals? What is the problem?
Because if they don't have to have it, then if they don't have it, then there's no
It's up to
consequences.
It's up to individual
Except
corporations.
You can get personal protective equipment on Amazon, yes.
And I know
they have pretty quick delivery, but
National Nurses United has talked to DuPont, and they do have the suits available. So it's not that there's a shortage of the equipment. It's the fact that the hospital has not provided us with the equipment.
Who's in charge of this hospital? Isn't that their responsibility to make sure that
Mark Laird is the CEO. Sheila Antrim is our CNO. There's a lot of people that are up in upper management that we've been talking. You know, we met with Sheila Antrim last week to talk with her. Nothing to us. She said nothing to us. She listened to what we had to say, and in about 15 minutes, and we went on our way.
So unless there's a comprehensive plan on how to take care of these patients, not just for us, but also for all other staff that might have to be emptying the trash, getting rid of it, making sure that other patients aren't infected, then we aren't ready until we have that.
Of the people who volunteered for the Ebola unit, but the other direct care nurses, which you say number into the thousands, that they have not received personal protective gear and they have not been trained. And since the portal of entry can be at any of the clinics and any of the hospitals, that's the concern. So is it true that outside the Ebola unit, the direct care nurses have not been trained? Is there any plan for training? Do they have the protective gear, and is there any plan for the protective gear?
Yeah, absolutely. So in the emergency department, there has already been training for the nurses and physicians in how to use the personal protective equipment, as well as in a screening and triage protocol. We are rolling out on Thursday screening and triage protocols for all of the rest of the portals of entry. There is an online module as well as aggressive training that will happen over the course of the next 2 days that will include the PPE training for all of those other portals of entry, which are actually different than the training and the PPE that are required in the isolation units.
Cal-OSHA, when we met, they were in the, we met with Governor Brown, and he had Department of Public Health, he had Cal-OSHA and a few other departments, and they told us that Cal-OSHA can go above and beyond. They don't have to wait for the CDC. They can institute their own mandates for California hospitals. I don't know. I think there's a lot of money forces, but...
Do you think that was the case in Dallas? Money?
Probably. I mean, I think hospitals are really, you know, operating on the profit principle and not the, you know, protective principle.
Now, I understand the Presbyterian Hospital had contracted out their emergency room.
I don't know. I don't know. But, you know, it's our duty to speak up and that we can provide safe patient care, and that's what we're doing here. This gives us the forum and the protection to speak up.
So if you didn't have a union...
It would be very difficult to speak up, yes.
That's what people felt at the Presbyterian Hospital in Dallas?
I'm sure. They were very scared. We tried to speak for them, but obviously we had to be very careful.
What do you think about the nurse that was put in?
I don't know. You know, seriously, this is such a crucial moment. We can't wait months for them to get their act together. We need stuff now. We have to be ready now. This is a top 10 medical center. We're in a major major city. We need to be prepared yesterday. Hospitals have a duty to provide safe patient care and protect their employees, and that's what we're asking UC to do.
Is this showing a systemic problem in the healthcare system in the United States?
Well, it's a fragmented system, yes. And I think if we had a single-payer system, there would be a coordinated response like there was in Canada with SARS.
And by fragmented, what do you mean?
It's a for-profit. Everybody's kind of on their own doing what they want. I mean, it you know, comes down to enforcement.